what we are following the V is equal to IR, voltage, current and resistance. These three, this formula what Ohm's law is applicable here. And just like this picture, if you understand this picture, the whole thing is that this is your water is voltage, just like in body, and nozzle is the resistance, this nozzle here, and the flow of water through the nose is the current. So basically, if you fix that, if you lightening this, the output will be less if you are doing it. So just like this body, your typically current and voltage system is working. Yes. Whole when we are giving the stimulating, what we are doing through the pacemaker, we are stimulating the electrical current. Normal voltage is 220. In body it is in millisecond. Millivoltage, 5 millivolt is the minimum current for stimulating our myocardium. So minimum voltage we are stimulating, and this is the pacing spike. Whether this current is coming and is captured. So the capture threshold is the minimum threshold on which it works. Normal, this is a very important, that our one is the acute threshold and one is normal. It should be less than 1 volt in the criteria whether we have to put new leads, and less than 2.5 in the chronic threshold. Generally 0.4, 0.5, 0.6 our accepting threshold, and 0.5 is this. So longevity of the battery, because most of the patients in our hospital we are following more than 800 to 900 constantly throughout the year, and their main questions is now how many of duration my battery will need now more. That is their main question. So capacity upon drain, that is the important part of the calculating the longevity. And now the pulse generator is able to tell exactly 2 years and 3 months. If this will be the criteria, then your battery will live for another 3 to 4 years. So that is the part of. Now one important is the unipolar versus bipolar. Earlier days we have seen so many patients twitching over the ear. Some patient in this area very gradually twitches. Why this? Because of the unipolar configuration. Unipolar means when we are implanting a lead here, the second part of their body circuit will be long duration from the contact of the patient. Now the bipolar lead is available, whether the two electrode, anode and cathode, both are in here. So there will be less time to travel and no twitching on this area. Second part is that if you are putting here both, then the spike will be less. So modern days pacemaker, earlier what typically spike was there, we will be not able to even see the spike. But so general physician and our doctors who are following up the pacemaker, the long days spike have gone. Modern day equipment you may get, may not get. So it is not criteria for it is not working. Now when we are following up, whether we have to, just like this is the bipolar, is the basic, because here this creates a small antenna, whether the current travels very general small space. So bipolar lead generally are more suitable. Now for the most of the other faculties like surgeons, those who want to operate a patient on the pacemaker, these slides is very important for their point of view for operations. Like your EMI. EMI is electromagnetic disturbance. Pacemaker is an electrical device which have a strong EMI, electromagnetic interference. So what happens? Common instrument like defibrillator, electrocautery, MRI, or Eurosurgeon's ESWL, extra shocks, wave lithotripsy, therapeutic radiations, those who are undergone for the post-chemo, post-cancer surgery, and radio frequency ablation. these are the common source of the EMI for the patients and the related doctors. So one by one, suppose quarterly, and most common practically your mobile phone. So first, defibrillator, if you are putting like this, it damages to solve. So we have to select on the basis of the threatening of the life. Our life is threatening, and the paddle should be 4 to 6 inch away from implanted pacemaker. Suppose a pacemaker patients have gone for sudden arrest and you want to RTF, BT, what we do? We have to defibrillate them, but our paddle should be as practically away from the pacing side. If it is a right, try to keep them as away as possible if needed. Second is cautery. What about the cautery? Cautery basically, if it is unavoidable, then what to do? Either we have to change the mode of the pacing. Pacing mode means suppose VVI pacing is there, VOO mode we have to change them. Make them in asynchronized mode and go on. Suppose it is a must that. Otherwise, maximum you have to avoid the cautery, because even on VOO mode you don't know at the time of suddenly it may go on this arrest. So ideally speaking, we have to change the mode and allow them to do the this. But practically, we have to better avoid the cautery and use the hands-based traditional maneuver for the stoppage of the blood vessel. Second part is that the myocardial thermal damage secondary to the transmission of electron energy may result in VFPI and both. So basic is the contraindicated. Generally avoid the electropop. Second part is that MRI. MRI, when most of the patients, recently last month, one patient we have received pacemaker with stroke, we have gone, I don't know, we are lecturing so many times, we have called it, our neurologists have given advice for MRI, and our house surgeon myself also have signed it, he has advised it, I have gone it, and we have sent the patient, and they have given after 7 days stage 4, 2 times we requested them to do the MRI as early as possible. And the last day, then the second or third, when we remember, it was a blunder from our side that why we have made this. But it started from neurologist, and we have carried on, our surgeon have signed it, I have also contract signed it. We have sent it, we have requested them to 2 times, and later on it was absolutely wrong that we have sent him for MRI. But patient has not gone, but it was a mistake for him. MRI is absolutely contract. Now, the days of the present day senior, what to do? Now, there are 2 brands of pacing is available. One is MRI resistant pacing. Ulla Chaudhary, recently, our famous swimmer, their husband is a railway employee. One day came with, she had history of fall in the Hazra Road. And her pulse beat is around 40, 42, 25. They have admitted in Woodland, she has admitted Woodland. They have suggested pacing. Their husband came to next day with all report, and they have suggested them to go for MRI resistant pacemaker in view of their athletic background, that at any time in future you may need sometime scanning. But since she is a swimmer, most of the athletes sometimes bradyarrhythmia is a major problem. So 40, 50, she refused to undergo for any type of pacing because she told that I don't need any pacing because it will hamper my career. I'm alright. One episode of seal coping, but then on return they are gone. Refused to operate. But that type of patient selection group, whether there is a major chance of the use of the in future MRI, the MRI resistant pacemaker is now new option. Is there, but the cost is 4 times. Normally we are getting the general pacemaker here in 42,000 international brand, and market price around there is MRP and 25,000. Their cost is 2.5 lakhs. One MRI resistant pacemaker. But maybe in future when it will come down in 50,000s, it will be might be replace the traditional medicine. So this is the option for you. Normally this guideline is that it should be contraindicated. About lithotripsy, sometimes the pacemaker patient need lithotripsy. Again, same like your cautery. Since lithotripsy is much away from this side, normal side, what to do? That we have to change the program either KBI to PPO or keep a focal lithotripter at least 6 inch away from the implanted pacemaker and monitor the heart throughout the procedure. So one standby cardiologist should be there. In any time if they are then put on the TBI and then put on. Otherwise better to avoid. Regarding radiotherapeutic radiations, because it is going to damage the different functioning of pacemaker, but we cannot predict it that a patient of the pacemaker is gone for that. But generally the ILS is contraindicated. If it is used, then much away from the side should be. So these are the 5-6 conditions we are getting in our hospital also. At various ways. Type of your ablation, we have to be very cautious about that. And regarding one is the mobile phone. Mobile phone is a very controversial. Recently, even some research has come down that even if area is having your mobile tower, people used to make a residential association and they are fighting against it that in my area don't bring towers because there are research that tower will produce some neurogenic, photogenic tumor. So many areas against Reliance they are protesting. But commonly that this is the situation. Here is the basement. You use opposite side and you keep the noun in this pocket, but you in the one pocket. This is the guidelines we are giving the patient as much away from your ears. In operative equipment, electrocoagulation, defibrillation, ECT in psychiatric patients, you have to be very cautious. Don't use diathermy, MRI, simulator like your orthopedic patient, whether the vibrations of this, better to avoid of this. Dental equipment, dental drilling at the time of this will sometimes be changed. Diagnostic therapeutic ultrasound with vibrated mode, we have to keep this, and of course lithotripsy. But what we can do, like your patient is your basic televisions, remote, no problem. Your micro ovens, no problem. Normal electrical appliances, no problem. But high security device like your arc welding, whenever there is an arc welding, this part is a very important part. Avoid arc welding, power lines, high tension wires, radio and major transmitters, your furnaces, electrical induction furnaces and major. So commonly used to avoid defibrillator, major contract, better to EMI, hardware, various type of instruments according to LP. So what to do, what to not do. It is a practical thing and we have to. If we will treat, patient will live long. And it is not it, there are good quality where you will fit it and forget it, but we have to follow that. With this, we'll end the talk and take for the best.